put some glasses on myself. I'm not quite sure how to get them off, but anyway, there you go. I don't know what Otica is. Anyway, professional show must go on. So hoping it's working. Wasn't working last week, was it? But let's just push on and assume it is. Supposed to be live on. Oh, there you go. Corin's in. It's Instagram never lets me down. Corin, these aren't glass. This is like an Instagram thing. So they're not actually there. See, not actually on me. But I don't know how to get them off. I was just pressing the buttons before. But anyway, I will do that in a sec. But I have got some questions which I will go over presently, and I'll keep them on. How do I? Nope, invite to join. That's the wrong one. No requests. How do I get the glasses off? Aha. Nope. Oopsie. Right, let's get no. There you go. That's it. They're off. Yeah, sorry about that. Oh God, what have I done now? I tell you what. I don't know if you've noticed, but nothing comes with instructions anymore, does it? Nothing. You know, you get the most complicated. I was talking to kids the other day. What are they doing? Playing some game, and it looked. Oh, that's right, FIFA. He was playing a FIFA game, and it looked really complicated. And I thought, there's no instruction book for this. Nothing comes with instructions anymore. I mean, Instagram's got no instructions. I don't know how you're supposed to know what everything does. Are we all just supposed to know, or nothing's got instruction? You buy the most complicated phone or computer, and you just open the box, and there's no instructions whatsoever. Just turn on. What happened? What happened to instructions? Well, look at that. Facebook's alive. Hi, Louise. Hi, Hope. Hi, Hope. Hi, Hope. Hi, Hope. Oh, hi, Hope you're well. Yeah, I'm very well, Elaine, Louise, and I hope you're well too. So I've got some questions here, which I'm going to kick off on. Does a breast reduction include a breast lift? Yeah, the answer to that is yes. It's quite common for people to say, I need a breast reduction and a breast lift. But you don't have to even ask for the breast lift. When you have a breast reduction, in order to reduce the volume of the breast, you have to reduce the skin envelope, and that therefore requires the breast to be lifted. So in many ways, a breast lift and a breast reduction are the same operation. It's just that a breast reduction removes volume. And in fact, I had someone who I saw last week who had already had a breast reduction or a breast lift. She'd had surgery anywhere where the breast had been lifted, and she wanted another reduction, but she didn't want the nipple moved because she's worried about the vascularity and what have you, which is quite right to be worried about it, because you can have problems with the vascularity and the nerve supply and the blood supply of the nipple when you do a breast reduction, but it's increased when you're doing a revision, when you're doing it second time round. So she didn't want the nipple moved, but I said to her, I can't really make the shape of the breast look good leaving the nipple where it is, because when you do a breast reduction, you usually take the volume out of the lower part of the breast to take the heaviness out of the breast, so it's less likely to droop in the future. And if you're just taking volume out of the lower part of the breast and you're leaving the nipple where it is, it's usually a little bit low anyway. And if you're taking volume out of the lower part of the breast and not lifting that nipple up and not tightening that skin envelope, your nipple's going to look weird. It's going to look at a low point. So you have to lift the nipple. You have to lift the breast when you do a breast reduction. It is an integral part of it. You do not have to ask, and you certainly got to be careful actually, because if you're ringing the hospitals, or if you're ringing the sort of the finance office or something to ring for a price for something, we've certainly been in this situation where patients have asked maybe someone who isn't clinical in the pricing office that they want a breast lift and a reduction, and the person in the office says, okay, a breast reduction is this much, a breast lift is that much, add them both together and however they do it, but charges them a huge amount of money, when in fact they should say that the breast lift is an integral part of it. So it's no extra to have a lift with the reduction. an integral part. Is a sleeve tattoo too big for tattoo excision? Okay, 2 should have 00. I accept that. But notwithstanding that, basically, yeah. I mean, we get loads of tattoo pictures. So if you've got a tattoo and you're wondering if to have it removed or not, then send us a photo. Very happy to give you an opinion. It's always the best way. People often say, "Oh, tattoo this dimensions and stuff." But if you send us a photo, we can just have a look. I would say, well, the vast majority, like 80, probably 90%, are not suitable, and certainly any of these big sleeves and things, whole arm, it's just not suitable. You can't take that much skin off. People talk about skin grafts and things. I'm not a fan of skin grafts, so I'm a fan of a direct closure, perhaps a serial excision, but certainly a big sleeve tattoo would not be suitable for excision. It's only for sort of relatively small tattoos or potentially bigger tattoos in areas with skin laxity, like the abdomen, where there's a bit more skin laxity. What have we got? Nice to be at home, by the way. Been at the hotel for a couple of weeks, but fortunately, I was well, not fortunately, just so happened to be. Normally, I do Mondays, and then sometimes Tuesday morning up in Liverpool. And I a couple of weeks I've been doing sort of late overnight on Tuesdays, but did the overnight last night, so back today. So nice to be back at base. Well, I went abroad for a tummy tuck, and I now have pain in my legs and fluid leaking from my wounds. What should I do? Well, you should see your doctor, basically. Pain in my legs is a bit of a worry. You're saying legs, which makes me sort of slightly less worried if it's both of them, but certainly if it's one of them, you do think about DVT, which is a significant risk after a tummy tuck. It's a risk after any surgery, but it's a significant risk after a tummy. It's an increased risk after a tummy tuck, and it's a significant complication. It's a clot in your legs, which can form pain or swelling in one of your legs, and that clot can fly off into your lungs and form a PE. So that's a significant complication that you need to seek help for if that's a possibility. It's hard. With this is all the information that I know, so it's hard to be too specific about it. But pain in your legs, fluid leaking from my wounds. Doesn't sound good, does it? I mean, I guess it depends on how long after the tummy tuck it is, really. Because if you had liposuction, it's not uncommon to have that liposuction fluid leak. So it sounds pretty bad, but it may not be that bad if it's in the first sort of few days, I guess, perhaps first week from surgery. Fluid leaking still a week after a week, be a little bit more concerned about, really. And I want to know what the wound looks like. Have you still got dressings on? So there's all sorts of questions here, which really, to be honest with you, I don't really want to get into too much, because really at the end of the day, it's your doctor who needs to be asked about this. And we often get people who ask and said they've been abroad and all this sort of stuff. And I think the point is, when a doctor operates on you, they've got a duty of care to look after you, whether it be abroad or whether it be in this country. So, I think, they should. This is one of the problems with getting abroad. I don't really know where you stand. In this country, if a doctor didn't look after you, you've got things like the GMC, you've got BARPS and BAPRAS. If they're members of BARPS and BAPRAS, you've got someone to go to say, look, this doctor's not looking after me. And and then there's a sort of an overarching governing body that gives a code of conduct of how we're supposed to be behave and what sort of service we provide. And I've always said that the aftercare is as important as the surgery. Now, often people don't need much aftercare, but sometimes they do, particularly for big ops like these, tummy tucks and stuff like that. It's quite a big op, and there is risks of issues and concerns and problems, and it can be very frustrating if you can't get help. I just had a thing the other day, well, not last week, the week before, my wife had a problem with her eye, and it was all swollen and things, and we had to call all these people. And I think the NHS does a great job of looking after you, but it can be quite hard to access the services because they are so overwhelmed, really. And if you're having private treatment, you don't really want to go into that service, and you shouldn't really have to go into that service. I was talking to one of the doctors at the Western Hospital up in Liverpool saying they're getting a lot of people who have been treated overseas and are coming to the hospital with problems. And it's not, it's not nice for the person, for the patient, to have to go to an NHS hospital with a problem. I mean, if you're really ill, NHS hospital is probably the best place to be. But things like this, if you're not really ill and you just got problems with your wounds and issues and things like that, that should really be treated by the hospital or by the doctor looking after you, unless you really obviously in a really bad way, then fair enough. But I think a lot of the problems are niggles and annoyances, and I don't know what to take about this one. I mean, as I say, it depends on how long ago the tummy tuck was, and I think pain in your legs is a potentially significant complication. So I do think you need to get that looked at. And my first port of call would be your surgeon. That is your first responsibility, or your surgeon's nurse, or the team who did the surgery. And I'm assuming, correct me if I'm wrong, anybody out there who's had tummy tuck or has had surgery abroad, they have some kind of person in the UK. Do they have some kind of liaison in the UK if you have surgery abroad? Do they have maybe a nurse here or something? Do they have someone you can see? Is there anyone you can see? I guess these are the questions to be asking before you go abroad, really. What happens if I've got a problem? Because to be honest with you, the NHS will look after extreme things, but they won't perhaps be as accommodating or as helpful as your own surgeon would be. Not least because they don't know what's been done. It's like me; I don't know what's been done. So yeah, go to your own surgeon is the advice. And they are doctors. They have a duty of care to look after you if they've done surgery on you. Does a breast lift include an areola reduction? All right, there you go. Yes, it does. So there you go. Look at that. This is what a breast reduction includes a breast lift, and a breast lift includes an areola reduction. So we should advertise breast reduction as breast reduction including breast lift and areola reduction. So when you do as I say, breast lift, breast reduction, similar operation with the breast lift, just reducing the skin envelope, whereas a breast reduction taking some of the volume away from the breast. But both of them are tightening the skin envelope. And in tightening the skin envelope, you move the nipple, you don't take it off. A lot of people think you take it off. You don't take the nipple off with a breast lift and a breast reduction. You can, but it's only really reserved for extremely large breast reductions, or at least in my hands, it is. Very rarely do it. And when you're doing it, you cut around the nipple and the areola, and then you really take all the skin away from it, and then you lift it up into a new skin envelope and then stitch around it again. So you can make the areola any size you want. So often when you need a breast lift or a breast reduction, the reason you need it is because the skin's been stretched and you've got too much skin. And obviously the areola is also skin. So the areola is often a little bit big, a little bit stretched for people who need a breast lift and a breast reduction. So it's not uncommon for people who have a breast lift to have an areola a little bit too big, and it is standard to reduce it. And certainly a discussion we can have if you've got a specific idea about how big you want it. You can certainly air that view. We can never guarantee it because you can get a millimeter ruler and you can draw a certain size, but in time the way the scar settles, it's unpredictable. Normally we have these nipple markers in theatre with different sizes and what have you. Normally as a ballpark, I would say 4 centimeters is a ballpark for an areola. But as I say, if you've got a view on it, you can certainly have a view on that. But 4 centimeters in diameter is a standard. 3.5 to 4.5 would be the range. You don't really want to go less than 3.5. It's going to look a bit weird. Less than 3.5, I think. What's Fifi got? Good to see you, Fifi. No, they don't. Plus, NHS is charging people who go abroad and come back with complications. That's news to me, Fifi. Is it? I'm not sure about that. But anyway, if they are, yeah. I mean, I think it's not ideal on both sides, as I say, in terms of the doctors who are working in the NHS, but also in terms of the patient with the problem. It's not really fair on the patient to have to go through the NHS, where you can imagine people sort of tutting and maybe perhaps being a bit disparaging if it is a complication that should have been treated by the people who did the surgery. So yeah, I don't know if they're charging people. I think they're looking at perhaps charging people who from abroad who've had surgery if they're not entitled to NHS treatment. I think they're looking at that. But I think if you're from here and you go abroad and have surgery and come back with a complication, I think they will charge you. And I don't think I think they'll treat you, and I don't think they'll charge you. Might be wrong. Don't quote me on that, but I think the main issue, as I say, is the fact that it's not really great for the surgeons in the NHS or the patient, because I've always said anyone who sends me a problem and says, "Look, I've got this and I've got that," I'm always said, "Look, you're better off seeing your surgeon." It sounds like a bit of it might sound like a cop out, but your surgeon knows what you were like before. They know what you did, what they did. And they might say, "Oh yeah, that was a bit tight, so that's why that wound's broken down." Or, "Crikey, I'm worried about that wound breaking down because didn't have much cover there and the implant's quite close," or "Actually, I've got a lot of cover over it, so it's not so worrying." Or what, they just know what they've done. So yeah, always best to, if you can, see your surgeon, or at least let your surgeon know and get a line of communication, even if it's an email or sending photos and things like that. We do that remotely. I mean, we do that here for people even in the UK. If you have a problem and you live far away, you can always send us a photo, and we'll have a look at it and give you advice in that way. But obviously, if you have got a big problem, then you can come back to the clinic to see us. But a lot of things are just little niggles and what have you. So where are we up to? Would you perform a breast reduction with BMI of 39? So I don't have a specific BMI cutoff. If there is a specific BMI cutoff, and people do have specific BMI cutoffs, if there is one, the BMI cutoff is 30, is the normal standard BMI cutoff for basically cosmetic surgery in general. I don't have a specific one, and I try and work with the patients to try and make sure that they get the best result they're going to get, which means they're getting their BMI right. So sometimes that can mean your BMI is below 30 and you want to get it lower, which case you should wait to have surgery. And sometimes that means that your BMI might be above 30, but you might not be able to get it lower, and you might be happy with your weight at that stage, and so you might have surgery then. So I don't have a specific number, but 39, got to be honest, I would say, yeah, that's too big. I think the wrong side of 35 is you're going to have higher risk of complications. Well, two things. First of all, you're going to have a higher risk of complications. Rebecca leaves you in the house. Good evening, Rebecca. Nice to see you. How are you? So first of all, you're going to have a higher risk of complications with a higher BMI. But also, to be honest with you, you're not going to get as good a result. The thing you've got to realize when you're having a breast reduction or whatever surgery you're going to have, tummy tucks, the same for anything, you're still going to be big. That's the other thing to realize. You're not going to be like small. You'll have smaller breasts, but you'll still have extra. You'll have extra on the sides, and you'll still be big. But also, you're going to get a better result if you can lose weight first, particularly if you want to lose weight. So if you're trying to lose weight and you want to lose weight, I completely understand the argument that says, I'm trying to lose weight and but I can't because I've got these enormous breasts. I completely understand that argument. That makes sense. But from a surgical point of view, don't have surgery and then lose weight afterwards if you can, because although it is difficult to lose weight when you've got big breasts or whatever, a big tummy, I think something like that. If you have surgery and then think, "Oh, fantastic, I can lose weight now," and then you lose weight after the surgery, potentially you're going to lose volume off your breasts. They might be too small. They might become too small. They might droop. So there's all sorts of issues that can happen if you lost weight after surgery. It's unpredictable, basically, what happens to your breasts. They might get smaller. They might droop more. And so you should ideally try and avoid significant fluctuations of your weight after surgery. So you're going to get a better result and you're going to have less risk of complications when your BMI is lower. As I say, I don't have a specific number for it, but I think above 35 is too high. And so 39, I think, is just a bridge too far, really. And I think that is too high, unfortunately, for a breast reduction. And you really need to lose weight if you can before having surgery. Hi, Rebecca. I'm very well. Yes, I am. I'm very well. Nice to see you here tonight. So, look, I haven't got any more questions here. I thought I had a lot. Have I just done them quickly or what? 1, 2, 3, 4, 5. I thought that was pretty good. Amy said she had 5 questions. I thought that was pretty good. Anyway, still, I'm a busy guy, so I've obviously got lots to do. So better get on with that then. If you've got any questions, you can ask. Obviously, if you haven't, that's fine. You can get on with your evening. Glass of water while we're waiting. But yeah, I got to put my feet up. They got into watching Below Deck next time. I mean, I watched it when it was first on because it was off and on parallel with Antiques Road Trip. So if I'd seen one, because there's a repeat, I'd go over to Below Deck. So I've seen a lot of them. And they're watching on Netflix. So that might be what you're hearing next door. So, yeah. Anyway. Right then. Well, anyway, actually, gosh, out of time. Got to go. So thanks for coming. And I will see you all. Not sure if I'll see you next. Look, Sam's joined. Sam, you know the time, love. 7 o'clock, isn't it? 7:25. What you playing at? Have you much plan for the bank holiday? Yeah. When I said questions, Corinne, was thinking more like BMIs and tummy tuck sort of questions rather than what you got planned for the bank holiday. But that does bring me to next week. I don't know if I'll do it next week. Probably not, because I am off next week and I'm probably going to go away. I say probably. I haven't booked it. Should have booked it. I know. I'm trying to. It's just narrowing down what something to do with the children. If anyone knows what we can do with the children, I'm thinking of hiring a camper van is the answer to that. So that'll probably be Tuesday. So I think we're doing something until over the weekend. Got to be honest, I can't remember what, but there was definitely something happening on Saturday or Sunday or Monday or something like that. Oh yeah, my wife's sister's coming over, and just trying to give some good time. Corinne, mediator there, good. Or moderator, yeah, mediator is more of a sort of hostage negotiation type thing. So got the sister-in-law coming over the bank holiday weekend, and probably going to take 2 of the children on a camper van somewhere, not sure where. Went to Cheddar a couple of years ago, which was great. Anywhere like Cheddar? Anyone think of Cheddar-like place in the UK? Anyone? Odette Holden is here. Good evening, Odette. You're probably thinking, what on earth is going on here? To be honest with you, so am I. It's a Q&A, Odette. It's a Q&A. I'm a plastic surgeon, and I answer questions on a Tuesday evening. I had 5 questions and I've answered them now, so I'm just filling in. And but obviously I've got a lot to do, so I've got to go and read the meters actually. So better go and. Oh look, here we go. Something happened. LKB 91. What are your views on BBL? Well, first of all, at LKB, I don't do BBL. That's the first thing. That's the disclosure. I'm a bit torn, I'll be honest with you, for next time. Oh, you don't want to do it now? I'll do it now, LKB. I'm a bit torn on it because the plastic surgery in this country, the plastic surgery community have been very negative about it, and there have been some deaths from fat embolus, so they've been very negative and they said we shouldn't do it. Having said that, there are some people from overseas who are doing it a lot, who say there's a huge market for it, a lot of people want it, and you can do it safely. So I'm a bit torn because I haven't really got into that world. I wouldn't like to say that you should or shouldn't have it. It's certainly popular, worldwide. It's a popular procedure, but it's just something I never really got into. I find it difficult. To find the aesthetic of it, because sometimes I see some results and I think, I don't find that. I find it hard to reconcile myself with the aesthetic. Although having said that, I went to a meeting a few years ago now with someone who's doing a lot, and he was saying, look, if you do breasts, you should do buttocks, because then he showed a photo of a woman sort of bent over with a picture of her buttocks, which kind of looked like breasts. Does that sound a bit weird? I guess it does sound a bit weird, but you know, he's basically saying yeah. But anyway, he said, you know, if you do breasts, then it's a similar kind of thing. But so anyway, and I'm probably at that stage now, KB, that I'm probably not going to do it. But you know, what I would say is look into it. You might not find someone in the UK who does it. Be aware of the risks, because there are risks with it, and there have been fatalities. So you know, be aware, but look for someone who's experienced in it. And certainly in the world, there are people who are experienced in it who say that they can do it safely. There's risk with everything. That's the thing, you know. So I'm not 100% on it. For the plastic surgery side, it's like, don't do it. It's evil. It's really bad. But as I say, when you talk to some people, certainly from overseas, they say, well, it's not all bad. You can do it safely. You're throwing the baby out with the bathwater type thing. The buttocks out with the buttock water. Lisa, what you got? Thank you for answering the question regarding high BMI. It's really helped. We'll be in touch when I've lost some weight. Yes, Lisa. Yes. 13. What was it? 39. Yes. Lisa, you can always come and we can have a chat. Always welcome. But I think the wrong side of 35 is a bit high in my view. I missed that. I logged on too late. I think you can watch it again. I think it just stays. I think you can watch it on Facebook or whatever. It just stays, I think, in the feed. Get the numbers up. So yeah. Anyway, so next week I'm probably going to be in a camper van. We were supposed to go a couple of weeks ago, but we didn't go, so it's so hot. Hopefully it's not too rainy next week. It's a perfect temperature. Not sure where, but watch this space. And week after, almost certainly I'll be here, won't I? God knows what's happening the week after, but I'll probably be here. 7 o'clock. Who knows? It might not go away next week. It might be here next week, but you know, I'm off. Officially, I'm off. So, all right, guys. I'm stopping the stream because I've got a lot on, and I will see you probably the week after next. Stop the stream.